Assalamualaikum and hi everyone. Today, ATIQAH and I, AFIFAH, will talk about the modalities in medical imaging. Do you know what machines do radiographers use? Let's start with the MRI machine.
Now we will learn about MRI machine. There are three types of MRI. The first one is traditional closed MRI. This traditional machine is that almost always produce image in very high quality, but they have tube small, so it can make people panic, especially who has claustrophobic. And the overweight patients simply cannot be scanned, as an effort to allow claustrophobic patients more comfort and to allow obese patients can be scanned, open MRI scan was developed. The last one is standing or sitting MRI. This is the desire to increase comfort to the development of MRI machine, but right now it cannot provide a good image quality, so this machine still in progress of improvement. History of MRI. We started in 1930. Nuclear magnetic resonance (NMR) first observed. In 1970, NMR technique found and we named it as MRI because nuclear was off-putting for patients. In 1973, Paul Little showed NMR could produce image. He made a variation of the strength of magnetic field and formed a varied signal from different atoms that will put a picture. Peter Mansfield developed the mathematical process that turned MRI into a useful rapid imaging technique. In 1971, American doctors discovered that MRI could be used for medical diagnosis. Scientist Raymond Damadian built the first full-body MRI scanner called Indomitable. Applications of MRI. We use MRI to examine the brain and spinal cord, bones and joints, internal organs such as liver or womb. For the cost, a new MRI system costs around 1.2 million USD. High-end systems can easily cost close to 3 million USD.
Now, we're going to look into something looking similar to the MRI machine but completely different. It is the CT scan machine, and there are several types of it, which are CT angiography, CT scan arthrography, CT scan bones, and CT scan brain. A little bit on the history of the CT scan machine, where back in 1917, Johann Radon found a mathematical theory called radon transform that brought technology to life. In 1971, the first commercially viable CT scan was at Atkinson's Murray Hospital, and the next year, the first commercially available CT scanner was created by a British engineer. The first ever human patient was tested on a woman believed to be suffering from a brain tumor. Then, on the 1st of October in 2017, Dr. James Ambrose was the first doctor to utilize the machine. What's the uses of the CT scan machine? Firstly, this machine helps to diagnose muscle and bone disorder. It pinpoints the location of a tumor in patient's body, and it also detects and monitors the disease and its conditions. Besides that, CT scan machine monitors the effectiveness of certain treatments, and it detects any internal injuries and bleeding. A CT scan machine can cost about as low as $65,000 for a refurbished one, and it can reach as high as $2.5 million for a larger and brand new machine.
Let's move to the X-ray machine. There are four types of X-ray. The first one is portable X-ray, that also known as mobile X-ray. It can be moved to various locations such as wards, nursing home, and intensive care units. The second one is veterinary X-ray. It is for vet, animal health research, and laboratory use. The third one is dental X-ray. Dentists use it to diagnose problems in our teeth and jaws. The last one is chiropractic X-ray. It can show what's happening in the body in terms of alignment and structure. For your information, X-ray is highly penetrating, ionizing radiation. Next, history of X-ray. We started in 1897. X-ray first used on a military battlefield during the Balkan War, which is to find bullets and broken bones inside the patients. In 1904, Thomas Edison's assistant Clarence Daly died of skin cancer. Scientists take the radiation risk involved with X-ray. Around 1930 until 1950, American shoe stores used shoe-fitting fluoroscope using X-ray to let customers see the bones in their feet. In 1950, the practice ended because it was determined to be too risky for health reasons due to the radiation, and shoe clerks had no formal medical training in using X-ray technology. The application of X-ray is to provide a visual image of its interior structure. The second one is to diagnosis and non-destructive testing of products for defects. The cost of X-ray is depend to the size and type of flat panel. It can cost between $62,000 USD to $140,000 USD. And it also depends on maximum power output options and type of detector selected, that can cost between $125,000 USD to $235,000 USD.
Now, let's jump into the ultrasound machine. There are varieties of it, such as portable ultrasound, high-class ultrasound, cardiac ultrasound, color Doppler, spectral Doppler, black or white ultrasound, and pocket ultrasound. When the ultrasound machine was first discovered? Well, back in 1877, where a French physicist named Pierre Curie discovered the piezoelectricity. Later, in 1912, a sonographic imaging was developed by another French physicist who named Paul Langevin. In between 1920 and 1930, ultrasound was used for physical therapy, and in 1942, a neurologist named Carl being the first who used an ultrasonic waves as a diagnosed tool. He transmitted an ultrasound beam through the human skull in an attempt to detect brain tumors. Ultrasound machine has many applications in life, such as producing pictures of the inside of the body, examining a fetus in pregnant women, evaluates the brain, hips, and spine, guide biopsies, and diagnose heart conditions, and last but not least, it assesses damage after a heart attack. So, how much does an ultrasound machine cost? For a new card-based machines, it roughly costs for about $20,000 to $75,000.
So that's all from us. Thank you for watching and have a nice day.